Sadly, the number of overdose deaths is up, and today, Waukesha County declaring fentanyl a community health crisis.
Losing your sibling is something unlike any other type of loss, in my opinion, there, from what I've experienced.
Caden's older brother, Logan, died on Valentine's Day, 2021, from fentanyl poisoning.
We want this story to be out there so people understand this isn't happening in somebody else's school. This isn't happening at somebody else's campus or somebody else's family. This is happening to all of us, and it's going to take all of us to solve that problem.
This is an issue for every person in our community. It may not be you personally, but it could be a neighbor. It could be someone who you see at the grocery store. So it's not just about the individuals who have used or have experienced substance use, but it's about the support network and really being able to have a support network in overcoming this.
What's amazing is you start hearing the anecdotal stories. It's not adults that are taking the Narcan out of the boxes. It's kids whose parents are addicted.
Things have shifted and it's a changing drug landscape, but right now fentanyl is very much our focus. Fentanyl is a drug which is 50 to 100 times stronger than heroin, and a very small dose can kill you. 2 milligrams, which is about 2 grains of sugar. The size of that is enough to kill a human.
The ways that I look at how we're starting to partner with our municipalities, our heroin task force that we have here in the county, and how we're working together to get more education out is really the success story that we've had in Waukesha County.
We have done a number of things at HHS really to address this crisis. Everything from working in our jails and working with community providers, going out into the community, really meeting people where they're at so that more and more people can learn and receive the treatment or support that they need in order to overcome addiction.
I would put Waukesha County up against any county in the nation in terms of the recovery supports available. The number of treatment options, the accessibility of those options, the harm reduction, the prevention, the recovery housing, medication-assisted treatment, and many, many different kinds of support groups. They're all here, as are programs for the families.
I think a challenge from the start was people were really hesitant. They didn't understand what naloxone or Narcan was. And so starting with education, what is Narcan? How do you safely use Narcan? What are the myths and the facts about Narcan?
The biggest thing people have is they hear of Narcan and they think it empowers addicts. They think it's another drug that can do something else. It's not. It truly is a medication.
Our traditional Narcan training includes education about what opioids are, how to administer naloxone, signs and symptoms of an overdose, and how you can interact with that person during that time, what the save actually looks like.
Waukesha County has distributed over 7,000 naloxone kits through its partner agencies. Through that, we know of at least 330 overdoses which have been successfully reversed.
We have a website that people can go to look at what's going on in your specific communities, what trainings are being held there. It shows how many people have died of an overdose fatality in your specific community, how many rescues have been able to occur by the use of naloxone, the trainings that happen. And we make sure that that information is up to date on a quarterly basis so people can see how their community is impacted.
The overdose kits that we have, the OAK kits that are out there, and trying to get them out in the communities, we're having people understand that they can get whatever it might be. If it's Narcan, they can get it. They don't have to ask questions. It's available, and they have it to save a life.
They are metal boxes. They're mounted on the wall, usually co-located with AEDs or in an area that's accessible to the public, so bathrooms, breezeways, entrances. They have 3 Narcan boxes in there with 2 doses in each box.
They also have fentanyl test strips, they have breathing masks, they have gloves to help people aid, because time is critical.
We continue to work and reach out to our partners to see if there's other initiatives that we should be including. Some work with our law enforcement courts, our DA's office to really do some pretrial work with people to, again, access treatment in our community. for people who encounter law enforcement, but we have treatment opportunities for people who aren't encountering law enforcement, really wanting to make a comprehensive, easily accessible opportunity for all.
A certified peer support specialist is somebody that has lived experience with substance use and mental health challenges and is able to use that to help other people that are experiencing them as well. Connection is what keeps us together, and that's what helps builds trust and forming relationships. And so I'm able to build that with them because I have connections, knowing what they went through, how they're experiencing those things. And it really does make such a huge impact on them trusting the suggestions and the advice that I'm giving them.
There is a gap in how we're responding to families who've lost a loved one to substance use. This position is an answer to filling that gap, putting forth different programs and initiatives in response to identifying that need.
When I look at it though, the impact that I see in the families and talking with the families, and I met Lori Bedore back in 2015 at the first Overdose Awareness Day. It was August 31st of 2015. She had lost her son a year prior, and started talking about it, and started talking about the impact that it had on their family. And then you start talking to other families that have had that impact. This is my job. We have to, That's why I keep sounding off as much as we can. That's why I go to the events. That's why I go talk to the families and work with people. This is an opportunity that we can make a difference one-on-one. And if I can lead the way with that, that's what I'm going to continue to do.